Hi, I'm Ciara Wright, and I'm going to talk today on the fertility friendly diet. There's a growing body of research on the relationship between diet and fertility. And I know that you know this, or you wouldn't be here watching this webinar, but it still amazes me when I tell people what I do. I'm a nutritional therapist and I help people get pregnant. And so many people look confused, saying, how's that now? To me, it makes perfect sense, of course. We are maturing eggs and producing sperm on a regular basis. So, of course, the raw material that we take in through our diet will have a huge impact on the quality of this output. Now, the research on the effects of nutrition on fertility is growing, although there are a few limitations to be aware of. Observational studies are the most common, and these give us information on dietary patterns that are associated with, say, better sperm parameters or increased pregnancy rates or improved IVF outcomes, but the causality cannot be proven. So that's the issue with an observational study. We see that people who eat in a certain way have better outcomes, but can we prove that this is the only factor? No, probably not. However, with the number of similar studies increasing all the time, we're getting a repeated confirmation of these associations in different countries and in different population groups. So it's reasonable to say then that we can take some guidelines from this. And it's now widely accepted by fertility specialists around the world that diet plays a huge role. Now, I just want to point out a couple of other factors to consider. So when we talk about dietary intake, this doesn't account for what we're absorbing, for example. So we see a lot of digestive complaints in our clinic, for example, reflux, low stomach acid, IBS symptoms. These are all associated with malabsorption. So even though you're eating a really good diet, perhaps you're not absorbing what you think you are. And it might not even be something that you have associated with your fertility at all. We usually measure blood levels of nutrients. It's a better way of monitoring like a recent nutrient intake and the absorption of that, but that's not always available. Other factors to consider are how much you need as an individual, because any kind of mass fertility friendly diet is for everybody, it's for a wide group, and you could be slightly different. So perhaps if you're overweight, it might mean that you're getting too many calories and you might need to adapt the diet for that. Don't get me wrong, I know that for some people, cutting calories doesn't actually result in weight loss. It's not as simple as that. And weight loss resistance is a totally different topic. But for the most part, just be aware that you might have to adapt general guidelines for yourself. Or else perhaps maybe you have a very demanding lifestyle or very stressful lifestyle or a very physically active lifestyle. We know from blood tests in our clinic that you might need more than the next person. You might have very specific nutrient deficiencies. So again, bear that in mind, what you might need as an individual. But all that said, I mean, for most people, adopting this healthy, fertility-friendly diet is going to result in fairly significant improvements. So let's just dive right in and see what this entails. Now, I don't think it's going to be a huge shock for anyone that science tells us that a fertility-friendly diet is high in fish, fruits and veggies, the pulses, nuts and seeds, and then low in red meat, saturated fat, trans fats, processed foods, sugary snacks, sugar sweetened beverages. It's your typical healthy, conscientious diet, maybe with a lean towards a Mediterranean diet. So let's just jump in and have a look at the key components. So if we start with fruits and vegetables, these are high in antioxidants, and antioxidants are really key to help support healthy sperm and egg. So they neutralize reactive oxygen species, which can cause damage to, say, sperm from a high level of oxidative stress. This can result in reduced concentration, motility, morphology, and higher levels of DNA fragmentation. In women, while we're born with all of the eggs, during maturation over the course of, say, 3 months, these are surrounded by a follicular fluid, and ideally this fluid is high in antioxidants to preserve egg quality. So brightly coloured fruits and veg, these are particularly high in antioxidant vitamins, including vitamin C, vitamin E, beta carotene, lots of polyphenols. And a fertility-friendly diet should aim to include 2 portions of fruit per day and about 5 portions of vegetables. Now, you do have to make a concerted effort to get 5 vegetables in every day. A good variety is important because they all contain different types of antioxidants. So try to pick up different varieties of fruits and vegetables in the supermarket the next time you're there. Also avail of frozen varieties. There are just a vast variety there. And these are actually quite nutritious because they're often flash frozen at the time of picking, more so than, say, fruits and vegetables that have been blown halfway around the world before they reach our table. Fruits and veggies are also a really great source of fiber. And high fiber diets are associated, of course, with a reduction in weight, which is helpful. I mean, some of you may have been told that you need to reach like a BMI of 35 or lower to proceed with your cycle. Increasing fruits or vegetables is a good place to start here. In addition, they can take the place of maybe more problematic carbohydrates in your diet. So if you're swapping out, say, pasta or potatoes at your dinner time for a large portion of vegetables or salad, or maybe have a large salad with your protein for lunch instead of bread. So this will reduce your calorie intake, but also significantly increase your antioxidant intake. So it kind of has a dual benefit. Fiber also binds to estrogen in your digestive tract, which may support a healthy hormonal balance, and not only in women, but in men as well. So a healthy testosterone estrogen ratio is necessary for the correct signals to produce more sperm. The brassica in particular, you can see here the kale, also cabbage, cauliflower, broccoli, bok choy. These are high in a plant chemical called indole-3 carbinol, and that inhibits aromatase, which is an enzyme which can reduce testosterone in men and also in women. Okay, let's move on to the fish. So fish is really low in saturated fat, which is really helpful for weight loss. And it can also reduce specific risk factors associated with the metabolic syndrome. Part of the metabolic syndrome is insulin resistance, and we know that that's a risk factor for sperm abnormalities, high DNA fragmentation, and infertility in general. It's also a really big issue for PCOS in women. A diet high in fish is also by default likely to be lower in meat. So there's just that reduction in overall saturated fat intake. Oily fish, such as your salmon, mackerel, herrings, sardines, and anchovies, if you can manage them, are an excellent source of omega-3 polyunsaturated fats, which are particularly important. For sperm, the outside layer is literally made of omega-3 fats, so this is essential in the diet to support sperm production. Supplementation of omega-3 has been shown to increase sperm count in studies, but you can get the equivalent amount from your diet by eating 3 or 4 portions of oily fish per week. For women, a higher omega-3 ratio in a Mediterranean style diet with low saturated fat increased the likelihood of pregnancy by 40% in couples that were undergoing IVF or ICSI cycles. Okay, your red meat then is much higher in saturated fat and your omega-6 arachidonic acid. There's been a dose-response association was shown between increased intake of saturated fats and a lower total sperm count and sperm concentration. Arachidonic acid can be metabolized to your pro-inflammatory chemical signals. It promotes your inflammatory cascade, which ultimately results in increased oxidative stress. So we've talked about that already with its link to sperm damage and reduced egg quality. So a better balanced diet that is including more fish, maybe more omega-3 rich fish, and less omega-6 rich meat will have a greater overall anti-inflammatory potential. This is important because of the egg and sperm quality, obviously, but also if you're considering immune imbalances, particularly in women. That again is a slightly different topic, so I'm not going to go into too much now, but increasing your omega-3 to omega-6 ratio is probably the most important first step in balancing your immune system. With regards to those processed meats, so your bacon, even packaged ham, salami, chorizo, it's actually not well understood why these are particularly detrimental to fertility, even though the correlation has been shown. So higher intake correlates with reduced fertilization rates in IVF. Might be some of the additives, they may have estrogenic activity, other unknown effects, but safe to say that it's best to avoid those. Then we have the pulses. So a diet high in pulses has been shown to associate with improved fertility and pregnancy rates. These are your legumes, your beans, lentils, peas. They're really high in fiber, low in fat. These are obviously usually part of vegetarian meals as a protein source. And again, this might be about replacing the higher fat pro-inflammatory foods such as your meat or your processed meat, and then including higher fiber and lower saturated fat, just like the fish, for example. So you don't have to go full on vegetarian, but just maybe be aware of the balance. The fiber, again, promoting a healthy hormonal balance and particularly beneficial in PCOS, where it's been shown to increase your levels of sex hormone binding globulin. Now, this is a protein that helps us to gather up excess hormones for excretion. We would always support our PCOS patients to include more pulses in their diet. I would say that if you're completely new to them, don't take in too many too soon. They're so high in fiber, they can be difficult to digest if you're not actually used to it. So just start with small amounts like hummus, maybe vegetable and lentil soup. You can make dinners that are half and half, so half meat, half lentils, for example, and then just work your way up, ultimately aiming to get one portion a day if possible. Okay, and then just to look at some of the treat foods, perhaps these might incorporate trans fats, so found in pastries, biscuits, cakes, processed foods. Now, trans fats are known to be pro-inflammatory, increasing your oxidative stress. And there was an interesting intervention study. So this is cause and effect, not just an observation study. So where increased intake of trans fats in young men caused a marked decrease in their sperm concentration. However, you could say that trans fats are often parceled with some of the other negative foods like your high saturated fat, high sugar. So when we talk about sugar, this is also linked to weight gain, obesity, insulin resistance, inflammation, all of the other kind of hallmarks of the metabolic syndrome that we've been talking about already, which is linked to sperm and egg damage and maybe hormonal imbalances as well. So all in all, the treats may be not so useful for us. Now, I'm not talking about natural sugar that's found in fruit, because if you think about that, that's parceled up with lovely vitamins and antioxidants. I'm also not suggesting that you have to eat perfectly all the time and that you can't have any treats ever. We really advocate for an 80-20 rule. So if you're achieving your fertility friendly goals 80% of the time, there should be no major problem with sitting down on a Friday night, maybe having a small glass of wine and some chocolate or some treats of your choice. I mean, I know how difficult the fertility journey is from personal experience, and I know how much of a strain it can be on your relationship. So, if that's something that you enjoy doing, sitting down with your partner, I think that actually that might be more important for your overall fertility journey than being on a super rigid, strict diet all the time. Okay, I hope that's been helpful. Please check out some of our other material, including the meal plans that we made for the Sims IVF. Maybe you'll get a little bit of inspiration and some more ideas that will help you along your way. Thanks.